Hello, we're FetchMD, and we are putting together this video today to describe what it is we're trying to accomplish with our startup. Essentially today, we have a problem in the healthcare industry, which is actual efficiencies overall, and the one that we focus on is the patient referral process. Today what happens is, for example, we'll just use an example, a social worker may be handed a case where they are referring out a patient who may have broken their back, and she is assigned the task to find and locate a facility that specializes in their specialty and subspecialty in her geographic location, and also accepts the insurance and plan that is specific to that patient. So she goes back to her office or uses online directories that are outdated by the time that they're published most of the time, and essentially goes through bunches of phone calls and validation until she can match that patient with the appropriate care. What we are proposing is to create an application that puts it at her fingertips, the directory, which is real-time data that she can specifically show, based and populate results based on the information such as the specific insurance company, the specialty, the subspecialty, and the geographic location. It'll also allow for filters that the hospital can control as far as inside network physicians have preferential ranking inside the internal system. And we have a proprietary algorithm that we use that's essentially described as like the eHarmony of locating physicians. And what that does is it essentially tries to, how would you describe it, Josh?
We're combining sources from the readmissions rates, government Medicare data on and preferences, and we're weighting each of these sources in a discriminant analysis to create a ranking so that not only can we pare down your search by the insurance match and ability for your patient, but also the other constraints you can have by specialty and subspecialty, but then within that set of possible choices to try to provide the best match so that the best care for the patient can be the primary cause.
So the second problem that we saw is on the receiving end of these referrals. These guys, for example, in the in-home healthcare industry or a startup facility, startup physician, sometimes have trouble locating patients getting through their door, or generating those leads, or finding the proper connections, and have to network and build or establish themselves. So what we do is we allow them to claim profiles within the directory that are already created for them, and we generate a pay-per-click type model where when that user or that care or the clinician is actually using the application and opens up that profile to execute a referral, we can then debit that receiving, or the person receiving the referral, or the facility receiving the referral, and that price is determined or scaled based on specialty or how much what that value is set to that referral. So we also may play around with a subscription model as well, but as of right now, that's the model that we're using. So we are hoping that we can solve their problem of having to invest thousands of dollars into marketers that, with a high turnover rate, that essentially causes a lot of waste of important cash flow for those smaller facilities, and especially startups, and at the same time solve the hospitals or the skilled nurses problem with locating and reconciling data and making that more efficient and quicker. And then there's profiles built within. So Joshua can explain, and Adam can explain more of the technical side of it, how this happens. But that's essentially the business model. So you want to explain how we're doing it?
Well, so right now, as Mike elaborated, the pain that we're solving is search costs. There isn't a single comprehensive source with aggregate data. So foremost, by being able to even provide the directory, you're already eliminating a significant burden in the process. And so what we do is we reconcile all of these data sources. This is something we've already accomplished in our alpha since startup weekend. We now have a single reliable source of data as an aggregate source of data that reconciles not only the geographic, specialty, subspecialty searches, readmissions rates, and all of the other metadata associated with these facilities, but the insurance, the most important element, whether or not this is a candidate for receiving the referral in the first place. whether or not there's some facility of payment. So by providing that, we now have a significant backbone, something the most important need. Then we're working on a proprietary algorithm, as Mike mentioned, that would allow us to introduce new elements. The eHarmony concept will allow us to evolve over time, something that would allow us to provide an ideal match, something that actually define a value-added component to this.
That's right. And so, anybody else have anything to add on what we're doing? So that's FetchMD. Obviously, we didn't record anything or prepare anything, but I hope that answers all your questions about us. Thanks.